Today is 4 minutes gone past 9 a.m. Still listening to Solid 100.9 FM. Good morning, everyone, and welcome to another enlightening edition of Glaucoma on radio, right here on Solid 100.9 FM Enugu. This is a program brought to you in collaboration with the Eye Specialist Hospital, Enugu, Nigeria. And I'm delighted to have you join us as well as we continue our amazing mission to create awareness, to deepen understanding, and encourage early detection and management of glaucoma, which, as we all know, is the leading cause of irreversible blindness. We will be focusing on a rather intriguing topic, and I'm sure you all out there are paying close attention to what we'll be talking about. So today's topic is centered around when eye pressure seems normal. When eye pressure seems normal. Now, many people who are associated with glaucoma strictly with high eyes pressure. But what happens when your eye pressure appears to be normal, yet vision loss continues? Some of you ask, how is that possible? What are the signs we should look out for? And how can it be detected early, to prevent blindness? Well, to help us unpack this very important subject today is our ever insightful guest, Dr. Suhaya Okeke of the Eye Specialist Hospital, Enugu State. Good morning, ma'am, and good to have you.
It's a pleasure to be here.
All right, and yes, she will guide us through what it really means when eye pressure seems normal. But, ma'am, let's start with understanding the basics, okay? Doctor, when we talk about glaucoma, most people immediately think of the high eye pressure. Okay, can you help us understand what it means when a patient's high pressure is normal, yet they have glaucoma?
Beautiful question, and that is the topic of the morning. Now, before we go into the topic, let's highlight the importance of glaucoma. Glaucoma is a group of eye disease that cause irreversible blindness, and I'm sure our listeners are now familiar with this.
Yeah.
And that if you do a timely eye check, we can always prevent blindness from glaucoma. So timely eye check is a key to preventing blindness, though it is irreversible. But if you present early, something can be done and you can remain sighted. That is on the brighter side. Now, coming to high eye pressure and glaucoma, many of us have grown used to glaucoma equals to high eye pressure. Once your pressures are high, the nerve in the eye gets sick and it comes under a lot of heavy burden, heavy pressure, and damage continues. That is, at least most of our listeners are now used to that fact. But now there is a variant of glaucoma. Glaucoma, as I said, is a group of eye disease, and it is a spectrum. Especially the type of glaucoma we see in this our environment is what you call the primary open angle glaucoma. And the primary open angle glaucoma has a vast spectrum, one of which is the normal tension glaucoma, or the normal pressure glaucoma, or the low tension glaucoma. Now, eye pressure, as a matter of fact, between 10 millimeters of mercury to 21 millimeters of mercury is the normal eye pressure.
Okay.
So you can go to the eye doctor, he checks and tells you your pressure is just 10. Your findings are okay. But that may not be truly sufficient, because that 10 eye pressure, even with a pressure of intraocular pressure of 10, damage can still go on in the eye. There are several factors that contribute to it. Now, when we say low eye pressure, every eye is different, and in the same person we have two eyes. One eye can behave differently from the next eye, and low eye pressure in itself can sometimes be damaging. So if you go and take a regular eye check and there are one or two things that are in keeping with glaucoma, though the pressures are within the normal range, the doctor might say, yes, your pressures are normal, but there is still damage that is being suspected or noticed. He subjects you to more tests, partly because glaucoma can still happen at low pressure. Now, some of these factors that contribute to low eye pressure damage or normal tension glaucoma is vascular condition. What do I mean? It's a big grammar. Many of us are very familiar with hypertension. And just like you have hypertension, there is also hypotension. Hypertension is when the blood pressure is high. When hypertension is when the blood pressure is low. Now, as simple as the words sound, many of our patients are also on pressure lowering medication to control the blood pressures. Now, as you are trying to control the blood pressure, you know the blood pressure has two values. The one is the upper value and the one is the lower value. Now, the upper value can sometimes, most of the time in a typical situation, the upper value is higher and the lower value might be below normal, below 90. Okay, in some cases you can still have 100, 110 for the lower one and 160, 170. So by the time the doctor is adjusting the blood pressure, when you see your cardiologist or any physician that is managing you for blood pressure, he tries to bring down the blood pressure, and when the blood pressure is brought down, the upper value goes down. That is the systolic high BP goes down, and at the same time the lower one also can go down. For those that have 100, 90, 80, it is fine. When it drops a little, it is fine. But for those that are at the level of 80, 70 and it start dropping to 60, 50, your eye is at risk. More so because when that, we call it the diastolic pressure. If the diastolic blood pressure drops below 60, for instance, blood flow to the eye is affected. And this happens most of the time in the nights because there is a natural drop in blood pressure, natural drop in eye pressure towards evening, especially around 10 p.m. After 8, 10 p.m. it drops. Then it starts spiking at 3 to 6 a.m. in the morning. So when it starts dropping that way, your blood flow to the eye gets affected, and once there is lack of blood supply, it starts affecting the nerve badly. That is the eye optic nerve, the wire that carries the message to the brain gets affected, and it can be damaging to the eye. So if you have blood pressure, it is always good to check your blood pressure in as much as you are checking it in the morning, check it in the night. And if there are medications you have to take in the night, if you are a glaucoma patient, you need to discuss with your doctor whether those drugs must be taken in the night, because it is not the best to have your pressures reduced in the night. It is better you adjust it through the daytime and or not in the nighttime.
Okay.
Then there are other factors. Sorry, there are what you call the central corneal thickness. Central corneal thickness is how thick or thin the cornea is. If the cornea is thin, those individuals have a strong tendency to develop normal pressure glaucoma. Then other things like sleep apnea. As sleep apnea means while sleeping in the night, your breathing can stop transiently, and it might not take a very long time. Maybe you might either it stops at interval for some seconds, or you might have shallow breathing, and or you might be an individual that snores deeply, and at that point blood supply to the eye is reduced. Those individuals are more prone to be developing normal tension glaucoma. Then there are also patients who are naturally inclined to a lot of cold. They feel cold at all time. Okay, they have some blood vessels that are very tiny, and they have some resistance to allowing blood flow, so they feel there is so much cold around them. They wear socks, they wear, even when others feel hot, they wear the socks, they wear sweaters, their hands are cold. Such individuals are more prone to be developing this type of glaucoma. So it is a holistic experience. When one is saying, yes, you might have a normal tension glaucoma or low pressure glaucoma, you really have to have a holistic assessment of the patient, a long discussion to assess where the patient belongs to.
Okay, you have walked us through the signs of all of this, but how common does this happen? Okay, when a person have this low, will I say, low, what will I put it again, normal eye pressure, okay? How common does this happen? And if the pressure is normal, what then damages the optic nerves?
Now, as a matter of fact, it is quite common. Okay.
If you have to give put it in percentage,
for every 10 patient you see, you might have one patient, or one out of 10 might be having normal pressure glaucoma. Okay.
Yeah.
And it is so sometime in our especially in our environment, it is on the high side. Okay, but outside it is a holistic assessment you have to do, because sometimes it can easily be missed because the patient has normal pressure, and if you are not too careful, you are not going to pick it. But it is quite common. It is not out of the moon. Now, the next question you asked is, if the damage is if the pressure is normal,
yeah,
why then do you have damage? The blood flow to the nerve is affected. That is where the problem is. Okay, you know, the blood flow means the blood is the nutrition that is carried into the eye. Okay, so there is less conveyance of oxygen rich blood, and with that comes a lot of problems. Okay, there are some of the mediators of tissue destruction are released, and because of that there is damage that goes on in the eye, and that damage can as well weaken the nerve.
I see. I see. Okay, I haven't known this. Okay, we've talked about the basics, understanding these basics, and for those of you who are just joining this conversation this morning, okay, we are discussing the topic when eye pressure seems normal, and then you are a glaucoma patient. or diagnosed with glaucoma. And in the studio with me is Dr. Suhaya Okeke. So we have understood the basics. We have talked about the science behind it. Let's take our discussion further and talk about detection and diagnosis. Okay, Doc, how can doctors detect glaucoma patients whose eye pressure readings fall within the normal range? Okay, and are there kind of like specific tests that can review the damages even when the pressure seems to be very fine?
Okay, fine. Now, before a patient is subjected to a lot of tests, first of all, you go into the clinic and you run your visual acuity test, and after that you undergo intraocular pressure test. Now, these are basic eye checks, and both of them can be good. You might have a 6/6 vision, which is the normal vision, and you might have an eye pressure of maybe 10 millimeters of mercury in both eyes. Now, the next thing is that is not sufficient because you have not looked into the eye. So when you look into the eye, the doctor actually looks into the eye. You will see that the optic nerve head, he assesses the optic nerve head. There might be features that are in keeping with glaucoma. Okay, the nerve might have a notching, the rib might be looking suspicious. Once he sees certain features in the optic nerve head, the doctor will subject you to, if you are found suspicious, he is going to send you for further evaluation, because just by looking into the eye, he is not going to conclude this is what you have. Okay, you are now going to be subjected to the very basics of doing central corneal thickness or pachymetry, which measures the size of the cornea, that is how thick or thin your cornea is. Then you will do the perimetry, that is a central visual field. Central visual field is a test that will indicate how much your vision is. You can see how far your field of vision how much you can see by your sight, left, right, up and down. Your eyes are two. Your eyes have the capacity to look straight, up, down, left and right. So normally you check that, so that in glaucoma, even when you have a normal vision, what goes off first is the peripheral vision or the side vision. The side vision goes off first. Now, is the perimetry or the visual field, when you are subjecting a patient to do, it picks some damage. But unfortunately, the perimetry itself only picks damage when the damage has really occurred in the eye. It does not pick damage, it does not pick a finding before the patient start manifesting symptoms. But that is why you have another test called the optical coherence tomography, or OCT for short. OCT picks damage quite early, even before you start having any symptoms whatsoever, at the level of structural level. That is, something is happening in your eye, the machine can pick damage early enough before you start manifesting symptoms. See, these are three basic evaluation you need to do, while the doctor himself does a stereoscopic examination. That is, he uses his slit lamp, the machine he has, with the help of lens, to look into the eye and document his own findings. And he now compares his findings with the lab results, and if they tally, then he will tell you, oh, you are either a glaucoma patient, you are a glaucoma suspect, or you have a pre-perimetric glaucoma. And then he also assesses the angles of the eye to know whether it's an open angle glaucoma or angle closure glaucoma. While doing that, he has checked your pressure, and the pressure might be in the neighborhood of normal pressures. Okay, it then means you might have a normal pressure glaucoma. But then it does not end there. If you have done all these tests and the pressures are still normal, the doctor will now subject you to what you call the water drinking test. Okay, it's a provocative test. You are going to, because this pressure, what you call the intraocular pressure, fluctuates during the day and night. Okay, it is not a number, it is not just a range. It is, you can come at 10 o'clock, you have a reading. You can come at 12 o'clock, it has a reading. By 4 p.m., it has a different reading. So it does not necessarily mean that you have an eye pressure of 10 and it has remained the same. Okay, and it is worse in the case of normal pressure glaucoma. The dips and troughs can be quite high. So doctor will subject you to what you call the water drinking test, in which you will drink minimum of 1 liter of water in the morning of the day you are coming for the test, and after the test you are given the water on an empty stomach, and your eye pressure is recorded at an interval of 15 minutes over a period of minimum of 2 hours, 2.5 hours. And now we check the pressure fluctuation, the baseline eye pressure at which you started and at which you ended. Maybe you started at 10 and over your testing period it was like it went up to 20, 21 or 25 and came down back to 10, right? It means you now have a range of pressure fluctuation. Some will do, and there is a pressure fluctuation between 10 and 25. So the range is like 15. Sometime you do 10 and 15. Okay. Sometime you do, the range is just 10, between 10 and 11. So if the range is not significant and you are still being suspected of glaucoma, you don't continue the argument again. You are a suspect, but we don't have evidence that you have normal pressure glaucoma yet. So you now step it aside and possibly you monitor your patient, because once you have a suspicion, you want to be careful and say dismiss the patient and send them to the general pool, because the chances of developing glaucoma still remain. So you are advised to come back depending on what you see, either 6 months interval or 1 yearly interval, to come for checkups. And if there is a variation, you start treatment. On the other hand, if you do eye pressure check and the fluctuation is more than 6, okay, now you know this patient is a clear candidate of normal pressure glaucoma, and therefore this patient needs to be treated, because it shows that at the level of pressure, this 10 we are calling is a hypothetical case. It can be 15, it can be 7, but there is damage going on in your eye at that low pressure. That is the simple meaning when you are talking about normal pressure glaucoma. So if we are sure that there is pressure fluctuation, that means we need to treat you for the glaucoma. The next thing is, yes, you are now diagnosed of normal tension glaucoma or low pressure glaucoma. What next is treatment. And the treatment is still about lowering your pressure. The doctor sets what you call the target pressure. Target pressure for any glaucoma, not only normal pressure glaucoma. For any glaucoma, you must set a target pressure below which further damage will not go on. So you set the target pressure, and you start reducing the eye pressure and aim at taking your patient to that level so that further damage does not go on.
Right. And how regular comprehensive eye examination, how important is it in this case?
Every 1 year is natural to take a regular eye examination, but if you are a strong suspect, meaning if you do an eye examination and there is evidence of optic neuropathy, the nerve is looking as if it is damaged, and you might want to repeat every 6 months.
All right.
Okay.
Very, very insightful. Let's now take this discussion further, okay? Because talking about this examinations, regular examinations that one need to pay close attention to, let's talk about the risk factors and the early signs, okay? I would like for you to tell us, are there certain people who are more prone to, this type of glaucoma? Is it boils down to age, family history, systematic conditions like low blood pressure, diabetics? Do they play a role in all of this? So which people are prone to what we're talking about today?
Okay, beautiful question once again. Now, glaucoma, as a matter of fact, is common in blacks and it is more common in Igbos, and the primary open angle glaucoma is common in the Igbos and in blacks, and normal tension glaucoma is a variant of open angle glaucoma. Now, those normal tension glaucoma, as a matter of fact, those members of your family, if their pressures have always been less than 20/21 and they are having eye challenge or visual impairment, they are at risk of developing such type of glaucoma. So it is a family history still plays a bigger role in the management of this glaucoma. Then the next things we should be careful about is it has a vascular component. So those that are being managed for high blood pressure should have and high blood pressure with normal eye pressure, and your medications you should have they are also at risk. Then there are individuals who are naturally having low blood pressures. Their blood pressure never goes up more than 100/60. The blood pressure is always, for some reason, even at 60-70 years of age, your blood pressure is always low. When it is low, it is good that it is low, but it then means the heart may not be pumping sufficient amount of blood to the eye. So these are the vascular components we should be talking and thinking about. So those patients are at risk. Then those that have migraine is an important factor. Migraine simply means they have constant headache, periodic headache that don't subside with medication, normally found paracetamol medication. For some reason they keep coming with migraines. Their eye pressures might be low, but they might eventually have this normal tension glaucoma, so they are at risk of developing glaucoma. Not that they have it, but they are at risk. Then those that snore, they have what you call the sleep apnea syndrome, so they might have some breathing stoppages incessantly while sleeping. The individual may not really know, but the partner or your parent, your spouse might know that my husband, my wife snores so much, and because of that you might raise an eyebrow that look, something might be wrong. So such individuals should even come forward and have an eye check done, because you wouldn't know when the damage is actually coming up. So these are and diabetes is an independent risk factor because it involves systemic condition. So it can predispose you to both high pressure glaucoma and low pressure glaucoma. So many of these factors still play a role. Then those that are myopes are short-sighted individuals. They can also develop normal tension glaucoma.
Alright, welcome back. It is still another exciting and enlightening edition of Glaucoma on Radio, right here on Solid 100.9 FM. Chibika James, my name, and also in the studio this morning is Dr. Suhaya Okeke, and we are discussing when eye pressure seems normal. Alright, we started with understanding the basics where we talk about people immediately think that eye pressure is associated, eyes pressure is associated with glaucoma, and what happens when one is with a normal eye pressure. We went further to talk about the science behind it, and we talked about detection and diagnosis. We also highlighted risk factors and early signs that we should look out for. And I told you all, once we come back, we'll be talking about the treatment and the management of these issues. But let us open up the phone lines where you can also call in and ask questions and react to what we are talking about this morning. The numbers to call to be part of the program this morning: 0704 550 2840. You can also call 0909 771 1009, as well as 0902 311 1009. Alright, those are the numbers for you to call to join the conversation this morning, and feel free to ask your questions as regarding this topic or any topic relating to glaucoma or the eyes. Alright, let's take this call. Hello, good morning to you. Hello. Alright, do call us back. Alright, so keep trying the lines. Call us back. 0704550280, 0909 771 1009, and also 0902 311 1009. Let's continue our discussions, Doc. The treatment and the management. Now, once diagnosed, alright, how is normal tension glaucoma treated, since we all know that lowering the eye pressure is the usual approach?
Thank you for that question. Yeah, I know once you hear it, everybody wants to know how it will be treated. Now, the concern now is you already have a low eye pressure and you want to make it lower than that. When you have a low tension glaucoma, it simply means that eye pressure, that our hypothetical eye pressure of 10 is causing damage to your eye, damage to the nerve is getting sick. So that pressure is in itself is not friendly to the eye, it is causing damage. So the normal rule is that you reduce the eye pressure by minimum of 30%.
Minimum of
30%.
Okay.
So you want to, if you have a 10 eye pressure, if you want to reduce it by 30%, it takes you to, you must have a drop by at least a factor of 3. So you want to aim at achieving it to 7. And there are different ways we can tackle this, and we have different modalities. There are eye drops available, there are surgical options available, lasers available, all aim at taking your eye pressure down to a factor of 7, the hypothetical 7 this time around. Now, it is not just taking wanting to reduce to 30%. You actually want to look at the central corneal thickness of this patient. If the patient has a thin cornea, for instance, if this patient has instead of the normal 535 to 555, he has a 490 corneal thickness. That means he has a thin cornea. So that means anytime we measure his eye pressure is falsely low, it might give rise to an additional factor of 6. So with that 10, you now add a factor of 6, becomes 16. Then we look into the eye and look at how the eye is. Depending on the level of damage, the doctor decide this is the pressure I think this patient needs. So he now sets his target pressure to be, maybe for this patient what he needs is 10 in real time, considering the target central corneal thickness, family history, other risk factors around him. Maybe he is a smoker. Smoking is an increased risk factor. Maybe he works all through the night and he takes a lot of caffeine. It only worsens your problem of glaucoma. More so is a normal tension glaucoma. So you look at the different parameters. He now has a factor of family history. Some individual in the family is already having some degree of visual impairment. If the risk factors are many, you want to reduce the target pressure to the level you need, such that damage will not go on. Then the doctor thinks maybe this patient will need this type of eye lowering medication, preferably a prostaglandin analog, which is an eye drop usually used in the night. The advantage is that it maintains eye pressure at a uniform way. Some eye pressure lowering medication has some influence on the blood pressure itself. Some are stable at night, some are stable in the morning, some are stable in the afternoon. So the doctor considers, depending on the background medical history you have, he chooses 1 or 2 medications for you. Then if you have hypertension, for instance, you need to liaise with your cardiologist or internal medicine physician, and now we aim at reducing the eye pressure such that the pressure lowering is not maximum in the night and the pressure lowering is better in the morning, but it shouldn't be done maximally in the night, because if you lower the eye pressure too low, it will damage the blood flow to the eye, and if the blood flow is affected, then the nerve damage continues. So it is even though you are working with an ophthalmologist, you must liaise with your cardiologist. These are days our patients also believe that you can manage the blood pressure yourself, because everybody has access to a monitor. You buy the BP monitor, you check the blood pressure and start doing things yourself. Okay, my blood pressure is good, and that summarizes it. And he has not seen the doctor for the past 3, 4, 5 years, because he knows the blood pressure reads the values. But that is not how blood pressure or even blood sugar, by looking at the reading, you don't manage it. It is just a guide, and it does not replace the function of a doctor. A doctor gives you a holistic view of what is going on in the eye. Now, if you have migraine, the doctor treats your migraine and you become a high index of suspicion for the doctor. He monitors you more closely than someone who never had high migraine. So it is, you don't actually treat eye pressure as one factor. You are treating the entire patient, looking at different parameters, so that your treatment option you are choosing works best for the patient.
All right, and talking about managing all of this, are there lifestyle changes or preventive steps that can help protect the optic nerve?
Very good question. Now, lifestyle modification is up on the discussion as of today, but a lifestyle modification is in different parts. You have exercise, you have dietary modification, you have weight management, so many things put together. It is not one size fits all. Somebody who you can say everybody, let's take a lot of fruits and vegetables. Okay, they are actually healthy, especially eating colorful vegetables and fruits are healthy. Why I said it has to be individualized is because some are already diabetic, so eating fruits and vegetable, because we came to the radio house to tell you eat fruits and vegetable, you go eating all the fruits and vegetable, tomorrow your sugar will run to 400. So it is not the right measurement. So if you have diabetes, you must still avoid all those fruits you cannot eat. You must stick to vegetarian fruit. You must stick to the one that does not have high glycemic index. Like, you don't want to take so much of orange and apple. You rather go for green leafy vegetables. Those ones are very healthy to the eye. You can go for ube, you can go for lettuce, you can go for angara. But for those that don't have sugar problem, you are free to eat carrot, mango, pawpaw. You have assorted spectrum. The sugar doesn't influence you, so you have to tailor according to your own health. Then for those that are active trainers, doing aerobic exercise is a very good way to sustain your life. Not only your eye health, it is also good for your general body health, and it is very important. But when it comes to aerobics, at least 4 to 5 times in a week, 30 minutes is sufficient. Now, what is not very friendly to glaucoma patient is doing exercise relating to yoga, especially things that warrant your head to be on the ground and legs to be up. Okay, so those ones can trigger increase in your eye pressure, and we don't advocate. If you are a glaucoma patient, you must be careful doing such maneuvers because it can worsen your glaucoma. Then if you are a smoker, it is not the best smoking. If you are into caffeine is coffee, tea, energy drinks. They are not the best. They affect your eye health, and just like it also affect your cardiovascular system, so you ought to be very careful. Then taking a lot of green leafy vegetable, fruits of assorted color, ideal way to go. But it is you tailor it and then have a good appropriate weight. Sometimes our body circumference, especially the abdominal circumference, the waist circumference, also influence what you do. If you have a large waist circumference, it also increases the eye pressure.
All right, and let's still take calls. 0704 5502840 0909 7711 We see your calls, but yes, we just need to get the management discussion of the way first. But let's go back and see if we can take 1 or 2 more calls before we wrap things up right here. 0704 5502840 0909 7711 and also 0902 311 1009. Hello, good morning to you. Hello. Alright, if you keep the calls coming, maybe the phone lines are acting up, I'll keep them coming. But Doc, let's summarize, okay, because time really is not our friend right here. Alright, for those listening to us right now, what message would you give to our listeners who may think that their eyes are just fine because their last test showed that they have normal pressure? And how often, okay, I did ask that question, okay, about going for comprehensive eye check, but specifically now for people who are 40 years and above, because you said at the start that the blacks, we in the southeast, and the elderly people are prone to, this very much. So how often should one go for comprehensive eye check, especially if one finds his or herself 40 years and above?
In a nutshell, yearly eye examination is very, very important. Yearly. Once a year, go for eye check. It is very important. But if you have a relative in your family who is either blind or who is living with glaucoma, please, you cannot escape doing this, and you must not still wait for that 40 years to come, because even though when you go through the literature it will say 40 and above, we see a lot of patients that are in their 20s, 30s coming to our clinics with symptoms of glaucoma. And the beauty is that if you catch glaucoma early, we can prevent blindness from glaucoma. You will remain sighted. So the fear of, if doctor diagnose you with glaucoma, that means I'm going blind. No, that is not what it is. The essence of all this exercise advocacy on glaucoma is that come early, treat your eye early, remain sighted for the rest of your life. That is why this program is in the air every week. Come for checkup early enough, do the needful, and follow doctor's advice. Remain sighted. It is when you neglect your eye and the eye does not complain.
And I'm sure she has extensively, keep us abreast with what we are talking about. Just so you know, this is a program brought to you with in collaboration with the Eye Specialist Hospital, Enugu, Nigeria. And with me in the studio today, I have Dr. Suhaya Okeke of the Eye Specialist Hospital. Doc, thank you very much for your insightful lectures.
Thank you very much.
All right, we'll see you all again, same time, same station, next week, Friday.